When we get to them, we'll see if he's out there, and if not, we can circle back to him if that works. So good morning, everyone. Obviously, November 10th. This is our November investor meeting for the Economic Development Alliance. We're excited to be here and excited to have all of you. It looks like we have 63 participants, so a good turnout this morning. If you can take a moment and picture 63 people in the library where we normally meet, or in the old fairgrounds, that's a pretty good turnout. Hopefully we'll be back there someday. Again, my name is Jameson Bobbin. I'm the chairman of the board of the Economic Development Alliance. A couple updates just from the Alliance standpoint. We had our board meeting last week, and obviously a huge topic of discussion was the increase in COVID cases, and then making sure from an organization in the event that there's more closures or restrictions that we're kind of on the front lines there, making sure that we can be responsive in a pretty quick way back to the business community and the membership. I think Mike and Emily will talk a little bit about that. From a board perspective, our focus really is in reviewing that strategic plan. We had 2 days of strategic planning with members from the city, county, tribe, kind of all over. Really great group, a lot of brainstorming. And so the board is reviewing that strategic plan, collecting accounts receivable. We've got, with the pandemic, we have quite a bit that's past 90 and 120 days. So the board will be reaching out to a lot of those members to try and get some of that collected just from a cash flow perspective. And then, like many other organizations, we're entering budget season. So we're working on the budget for 2021 and trying to get that kind of wrapped up. That's really the board updates. At this point, I will turn it over to Mike or Emily for the executive director update and let them let you know what's going on there. Mike?
Thank you, Jameson. Good morning, everybody. According to retail and real estate, we had another really strong month in October. That adds to a very robust summer and fall. Plata County September unemployment numbers were 5.1% compared to 6.4% in the state. And that is ahead of where we are as a country at 7.9% September numbers. State numbers came out this week, last couple of days. As a matter of fact, I think it came out yesterday for October. Year to date, these are our October numbers. Year to date, we've in La Plata County, single family home units, 1,181, and that already exceeds 2019 numbers. There are still 235 units under contract, but we'll have a record-breaking 2020 without closing another deal. And that goes way back to when we started recording these numbers. So the other thing that's on the rise is home prices in a record-breaking scenario. And with that comes significant on inventory. Inventory down over 50% across the board. It doesn't matter which segment you're looking at. It's Durango in town, Durango rural, Bayfield, Bayfield rural, and Ignacio. The biggest concern right now, though, even though we've had a really strong summer and fall, is the impending pressure on the economy with the pandemic. All these great numbers are overshadowed by a very critical and growing health concern. If you haven't been reading the papers, the state of Colorado is starting to be in the negative category of worst 20 states in the country versus the best, the top 15 or so that we've traditionally been in. In Denver from 10 p.m. to 5 a.m. now to squelch any of the social gatherings and and we're seeing a significant case increase and transmittal rate increase in La Plata County. So we'll talk about that quite a bit. What I would ask is that everybody do their part in order for us to stay open. We're going to have to be diligent. I realize people have a lot of fatigue, and this has been a really challenging time. Now is when it counts. How we address this period will determine what our December and even January will look like. With that, I'll hand it back over to Jameson, and thank you very much, Jameson.
Thanks, Mike. We had a little bit of breaking up there during the presentation. Hopefully everybody heard a lot of those updates. We'll move on to Brian Devine. He's the Environmental Health Director with San Juan Basin Health and the Incident Commander. Brian, are you with us?
I am. Sorry I'm a little late this morning. I had to restart my computer, as one always does right before having to give a presentation, but it looks like I'm just in time. I'm going to try to do this with my computer screen on, or my video on. It sounds like we're having some internet troubles today, so I will turn it off if I have to. But at any rate, good morning, everyone. I'm Brian Devine. I'm the Environmental Health Director at San Juan Basin Public Health. I'm also the Deputy Incident Commander for our COVID-19 response, and I'm here to give you an update on our response activities and the status of the pandemic in La Plata County. So go ahead and go to the next slide. Our response is organized into a couple of operational groups. These operational groups are based on the tools that we have to fight disease. The first of these is surveillance. I'm hearing a little bit of feedback. I'm not sure if that's me or if somebody needs to mute themselves.
I think Jameson.
That sounds a little bit better. Okay, anyway, so our tools to fight disease start with disease surveillance. Obviously, we have to find disease where it is in our community, so that is our testing program, as well as a couple of other surveillance tools that we use. Next slide. As you can see here, our surveillance is identifying some pretty startling trends. We have this is statewide, not just in La Plata County, but in statewide, you can see that the number of cases is significantly higher now than at any point in this pandemic, and the rate of increase continues to go up. I have some more slides about this, but I'll just try to make this sink in. Every time the state tries to predict the number of cases a week out, or the number of hospitalizations a week out, based on current trends, they end up underestimating it. Every single time we come up with a pessimistic prediction for where this pandemic is going to be, for the last month or so, we've been wrong, and we've been wrong in the wrong direction. So we now have over 2,000 cases a day reported in Colorado. This is putting strain on our case investigation system. It's putting strain on our testing sites around the state, and it's starting to put strain on our hospital system. Next slide, please. This is what I was talking about as far as the trends. The state runs a model once a week, which is a hospitalization-based model. Essentially, we take the number of known hospitalizations and try to calculate how many cases that represents. Then we take the change in cases over time, and that produces basically a transmission rate, which on this graph is the RE number that you see on the left side of the screen. This is called a reproductive number, which is the average number of infections caused by an infectious person. As of last week, this was estimated at 1.66. I happened to see yesterday morning the most recent number. We don't have a new slide on it, but the most recent estimate is actually around 1.75. That means that on average, every person who's infected infects more than one person and close to two people. And this is exponential growth that we're talking about, which means those two people tend to infect 4 people. Those 4 people tend to infect 8 people. And you can see why this thing grows even faster than we anticipate. On the right side of this slide, you'll see the state's estimate for transmission control. This is something that's calculated out of the model. Essentially, how good are we at slowing the natural growth of the pandemic? If transmission control were 100%, cases would go to 0. If transmission control were 0%, then cases would spread naturally throughout the community. One thing I'll point out here is it's been falling over time. You can see that we were doing about 67% transmission control in early October. Most recent estimate is about 62% and continuing to fall. This is not a big difference in people's personal behavior in terms of staying home when you're sick, avoiding large social gatherings, avoiding any social gatherings, working from home even when you're not sick. These seem like really small changes in our own lives, and it's easy to question whether they have any actual impact on the transmission of the disease. And they really do. So you can see on this slide, the difference between 67% and 62% transmission is the green line and the yellow line. And these don't seem like they're terribly far apart in hospitalizations. But if we can go to the next slide. Actually, I guess I got rid of that slide. Well, at any rate, the point is that these lines diverge over time. And they are, I think the difference between 67% and 62% transmission control adds up to something like 500 hospitalizations avoided if you just carry that out a month. Because we're talking about exponential growth and we're talking about small interventions applied across a large population, transmission control is the difference between literally thousands of deaths avoided or occurring by December 31st in Colorado. The last time I looked at the state model at 65% transmission control, we were looking at a cumulative of something like 3,000 or 4,000 fatalities. And at 55% transmission control, which is entirely reasonable that we might achieve, factoring in Halloween, election night parties, Thanksgiving, and Christmas. With all the socialization that happens over these occasions, it's very reasonable that we might get down to 55% transmission control, which puts us at something like 11,000 deaths by the end of the year. So literally, these small choices can save thousands of lives if applied across the community. Here in our own counties, and we do serve Archuleta and La Plata County at San Juan Basin Public Health. Here in our own counties, we have case data that are starting to get pretty alarming. You can see on this graph the sharp increase that we've had in La Plata County over the past week or so. We've gone from about 5 cases a day, investigating 5 cases a day, to investigating about 15 cases a day, and in the past 4 days, investigating about 30 cases a day. This is, again, straining all of our capacity as a team and causing us to try to activate additional resources in the community. Next slide, please. This is the same information presented in another way. You can see the number of investigations that we've had to do in just in the last couple of days, and that the vast majority of those have been La Plata County residents. Next slide, please. As far as symptom onset, it is a little bit more spread out. Obviously, there's time between symptom onset and reporting to public health, but no matter which way you look at it, we are experiencing a surge here in the last couple of weeks. Next slide, please. This is the same information adjusted for population, and this is a really, really important slide. The state's public health order contemplates that restrictions on economic and social activity in a county should be tied more or less directly to the underlying data for the pandemic in that county. The most important metric that we use to determine what restrictions are appropriate is called 14-day cumulative incidence. And that's simply the number of new cases in 14 days adjusted for population. Our target in this metric is under 25 per 100,000 people. In Archuleta County, our target is under 50, and that's simply because it's a smaller county and small shifts go a long way. It's really hard to stay under 25 there. So we've got on the La Plata County graph, 25 new cases and 50 new cases in horizontal lines, and we're running out of space on this graph. We're now up above 350. 350 is the incidence rate, which, if that were sustained over time, a stay-at-home order would be appropriate. So I just want to say that again. We are alarmingly close to needing to consider a stay-at-home order for La Plata County. Right now, La Plata County, we don't see a great way of turning that around except for reducing contact between people, increasing the wearing of face coverings and the use of physical distancing in workplaces and social events, and increased testing. We have a very exciting testing program that we're just about ready to announce that will do ongoing asymptomatic surveillance testing of certain populations in an attempt to find asymptomatic COVID-19 disease before those people have a chance to spread it to others who may become ill. So those are our real tools in an attempt to turn this thing around, but I won't sugarcoat it. It doesn't look good. And we are going to be enacting some additional economic and social restrictions, which I'll get to later in this presentation. Next slide, please. We do have widespread testing availability. That's probably the best thing we have going for us at the moment. We operate a community testing site across the street from the Durango Public Library. There's also testing available through some private partners, including Cedar Diagnostics here in Durango. And again, we're trying to stand up additional testing opportunities with some of our partners to catch disease before it spreads to people who become ill. Next slide, please. Our other tool here, besides surveillance and case investigation, and I don't really have any slides on case investigation because it's just proceeding as it has before, is mitigation. And mitigation is our transmission control efforts in the community to reduce that level of spread and bring things under a little bit more of control. Next slide, please. The state does mitigation through what they call a dial. And the dial, again, tries to associate those mitigation measures with the underlying data for spread of disease. Currently, La Plata County is at level yellow on the dial, which is the middle one. And yellow was kind of the status quo over the summer. That is not anymore an appropriate level for La Plata County, given the increase that we have seen. We will be announcing this week a move to level orange in the community. We should have a press release about that today. And I'm not sure if I have a slide on level orange, but essentially what it does, everything on this graph that you see at 50% capacity, generally speaking, goes to 25% capacity. This is going to be a pretty severe change for a lot of your members and for a lot of businesses and special events in the community. We tried our best to avoid needing to take this step. But as you can see, our case rate has grown even faster than anybody anticipated. And it is going to be necessary to reduce capacity at businesses and events in the community. Next slide, please. There we go, level orange, perfect. So this is where we're headed. It's going to be in effect later this week. I don't have the exact date as of yet. We're still working that out. But again, as you can see, most things go from 50% to 25% capacity. One thing I want to point out is this does not require any changes in our schools. Schools are listed as a critical entity in public health orders, which means they just have recommendations, not requirements. We are in discussion with all of our school districts as far as what learning model is appropriate for their community, given the number of cases that we're seeing. I think there will be some changes, but they won't be quite as widespread as they will in the business community. It's really incumbent on all of us as leaders in the community and on all of you to take the initiative to reduce transmission control in your workplace and in your social life. Most people we've found in this pandemic are perfectly happy to do what the people around them are doing and what their community leaders are saying is necessary. We have a tendency to focus on bad actors. I think that's natural. I think it's also something we should try to avoid. Most people wear a face covering when they are out in public. Most people do not socialize at bars until late in the evening without a face covering and meeting people that they don't know. Most people do what is appropriate for their community, and it's important for community leaders to model that behavior. I would ask all of you who are listening to this call to take that initiative by reducing your in-person workforce as quickly and as sharply as possible. We've had the entire summer to get accustomed to coming back to work in person. Now is the time to get everybody home who can possibly work from home. We have done that in our own operations. We've canceled a lot of our field visits in the environmental division. We're starting to wind down our in-person appointments for our traditional health programs. And our administrative staff have begun working exclusively from home. It's time for all of you to take the same steps to keep your workplace safe and your community safe. I can testify that in case investigations, when we go to investigating 30 cases a day, there are workplace exposures at well over half of those, which means we are on the phone with workplaces, identifying who was working there, who was exposed, who needs to get tested, whether that office needs to close due to lack of staffing. You don't want to be in that position. And the way to avoid that is to get as many people working from home as possible and to rigorously enforce symptom checking at your workplace. We have a lot of evidence of people going to work while sick. And we've all been there. We try to suck it up. We try to shake it off. We say, it's not that bad. And I really can't afford to miss work today. Do not be the workplace that is in the press for having had staff work while they had symptoms that got other staff sick. You do not want to be in that position. Your community does not want you to be in that position either. And finally, when you're at work, we want everybody to be rigorously practicing face covering and physical distancing. We think that there's a lot of businesses that do that in their public facing operations because they know they'll get complaints and they know customers expect staff to be wearing face coverings. But it's been a trend that's emerged in our case investigations over the last week that in the back office, where no customers are there to see it and maybe report it, that people don't wear face coverings. They don't think it's a big deal. That's not a good idea either. That's a great way to get an outbreak in a business. Next slide, please. This is the full list of changes from level yellow to level orange. I would just recommend that you go to our website or to the CDPHE website, the State Health Department website, if you're looking for the entirety of the changes. Again, the theme here is going from 50% capacity to 25% capacity at most establishments, except for critical businesses. Next slide, please.
Brian, this is Jameson. We've got a couple questions out here. If we can pause for just a moment.
We can. In fact, this is my last slide. I just want to say the last activity we've started beginning is medical surge planning. As I mentioned, with our number of cases, we are very much putting our hospital system at risk. We wrote a medical surge plan with our hospital partners back in the spring. We've reactivated that plan and we're making sure it's brought up to date. This is an activity going around all around the state. Our hospitals are under a little bit less pressure than on the Front Range, and that's because we're generally trailing the Front Range in case increases. Front Range hospitals have already also started accepting patients from Wyoming. So I just want to say to everybody, the worst case scenario here has always been overwhelming our hospital system. We're very much planning for that. We have really good relationships with our hospital partners to make sure that we're able to avoid the worst of it. And now I'll be happy to take some questions. I do believe that's my last slide.
Super. Thank you, Brian. Again, this is Jameson. Thanks for the update. The first question, is there an average turn time for testing results, and is the time improving in the county?
Excellent question. The short answer is that depends on where you're getting tested and what lab they use. Our community testing site, we have just switched laboratories to a private lab in California. We're now averaging test times of 2 to 3 days, or turnaround times of 2 to 3 days, which is a significant improvement. I do think that's starting to come down elsewhere. But private labs, I've heard actually pretty similar at this point, generally between 2 to 3 days turnaround. There's a lot of different types of testing that are coming online now. They are not all appropriate for the same purpose. It's going to be very important. I have a feeling that workplaces, especially larger workplaces and business groups like this one, are going to, hear about new types of testing apparatus that they can buy. And it's going to be really important that you consult with us if you're considering something like that, because different testing is appropriate for different purposes and the results are not interchangeable. So at the moment, we are relying on that community testing site, our new asymptomatic surveillance option that we're developing, as well as a couple of others that are going to medical offices, starting to filter into medical offices. But the testing landscape changes just about as fast as anything else with this pandemic. New tests are being developed and approved all the time.
Super, thank you. What happens to non-emergency or elective surgeries in level orange?
As far as we know, that that allowance is not tied to the state dial. So I think it will be important for hospitals to prioritize the types of patients that they see, but the public health orders do not order a stop in elective procedures or non-essential procedures or whatever you want to call them if we go to level orange.
Super. And then with the rise in cases and demand on testing in the county, is there a plan to increase the testing sites?
Thanks for that question, Jack. The answer is yes. We're doing a couple of things there. Number one, we're working to increase the hours of our existing site. The second thing is possibly adding an additional site or relocating the community testing site. We do have a traffic control problem at the existing one. As I also mentioned, we're adding testing for some of our testing for certain entities in the community to try to identify disease in asymptomatic people. We're doing this because we know a large percentage of disease in the community is asymptomatic, probably something on the order of 30 to 40 to 50%. Probably not 50%, probably on the order of 30 to 40%. And so when asymptomatic disease is present in a population that has lots of contact with the public, it does lead to a lot of people getting sick and possibly or getting infected and possibly becoming ill. So we are working with some of our government partners that have lots of contact, that have employees with lots of public contact to do ongoing asymptomatic testing. We'll be the first site in the state to launch something like that.
Thanks, Brian. I'll lump these two questions together. Do we know how many COVID patients are at Mercy today? And then what is the status of Mercy's ICU beds? There's rumors that those beds are full.
We do get a report from Mercy daily. I don't have that open in front of me. It will be updated in the next hour or so. So I don't know the status of their ICU beds at the moment. With hospitals, it's really important to remember that beds is not the only determining factor for providing care. We also have to be concerned about equipment. We have to be concerned about personal protective equipment, PPE, and we have to be concerned about staff at all of our hospital partners, not just Mercy. The medical surge planning work involves all of those components. I just want to be really, really clear that whatever the rumors are, whatever the information that's floating out there, people should not be avoiding seeking care. It's really, really important that people don't avoid getting medical care when they need it, no matter what phase of medical surge we are at. And right now we are not in medical surge, just let me be clear, in the Southwest region. There are places on the Front Range in Northeast Colorado have activated medical surge. We are not in medical surge in Southwest Colorado. We have a plan if we need to do that. No matter what happens, people should not be avoiding seeking medical care. There's a lot of evidence that back in the spring and early summer, there were a lot of illnesses and fatalities that came about, not just due to COVID, but because people were afraid of seeking medical care or believed they would not get help. It's really important that we avoid that this time around.
Thanks, Brian. And then last question from Clyde. He says his understanding is that free community testing is for symptomatic and exposed people. Where do people go for travel or other non-medically needed testing?
Excellent question. That is correct, Commissioner Church. Our community testing is for symptomatic and exposed people. People who need to be tested for other reasons, if you need a note to get to your employer or for travel, purposes. That should all be arranged through a private testing provider, such as Cedar Diagnostics. There are a few others out there in the community. I think Cedar is the biggest one. You can always take a look at our website, sjbpublichealth.org/testing, to find, it's not a comprehensive list of testing providers. As I said, the testing landscape is changing all the time. And so it's impossible for us to make that a comprehensive list, but we do have a list of private testing providers on that webpage.
Super. Brian, thank you for your time this morning. Really valuable update. We appreciate San Juan Basin Health as a partner and trying to get on the leading edge of how to control this. So we appreciate it. Thank you for your time.
Thank you all very much for your time and attention and for helping us do the right thing in the community.
Absolutely. We'll move over to President Tom Striticus for an update on Fort Lewis College.
Good morning, everyone. Great to see everybody's name in the chat. Brian, thank you for your leadership and Leanne's leadership. We are lucky to have you in our community. As folks know, we were scheduled to start virtual close of the semester during the Thanksgiving break. That was 2 weeks away. Given the rising case counts locally and the strain on our contact resources, contact tracing and isolation spaces, we accelerated that move to virtual 2 weeks. Campus is still open. Residence halls are still open. Campus services are still open. And by and large, our students did an amazing job. And I think we found ourselves in a situation where our resources, our ability to isolate people, and essentially what was going on with San Juan Basin Public Health, that we felt moving to virtual was a preemptive move to try to break the chain. I want to reiterate a couple things for people. We have not yet had an instance of classroom spread at Fort Lewis. So by and large, this is about navigating and managing our residential student population. This is obviously very different than 9R, which has not had a case of classroom spread to my knowledge. So these are separate issues as you're thinking about it. To Brian's point, let me just say, I think it's incumbent upon all of us as leaders to really think about the things big and small that we can do to try to break the chain. And a lot of what we saw from Halloween was not your idea of, oh, there's a bunch of kids in a raging house party, which we actually didn't have. But this was people throughout our community, not just students, getting together in groups of 6 or 7 where spread happened. So we have to be very thoughtful, very conscientious of how we're moving forward. Fort Lewis is going to try to continue to do that. We are essentially working students back into their home communities, making sure they get tested before they leave. But you will see our students getting groceries, hopefully enjoying the outside, and finishing up their last 2 weeks virtually. So since Brian gave us a lot to cover, and I'm sort of just reiterating some of that, I might stop there unless there are questions and pass it over to the next person.
Super, thank you, Tom. Doesn't look like we have any questions. We'll move to Nan Penzruder from Southwest Health Alliance. And that is not a picture of Nan.
We should be at Mike McVeigh.
Okay, Nan, we'll hang tight. Mike, if you're on, let's go ahead and go to you at this point.
Good morning. This is Mike McVeigh. Can you hear me okay?
We can. Thanks, Mike.
Okay. I'm going to share some screens here pretty quick. I need some help being able to do that, Emily. Says I cannot start screen share. All right. Just to kind of talk about the connection project and to update everybody on what's going on, I'm going to show you one screen real quick. The project is, here's some pictures of one of the bridge piers being constructed right now. That pier is these 2 piers are part of a 500-foot long bridge that is being constructed by Lawrence and Construction. Those piers are going to be over 100 feet tall to get across this gulch. I think I'll show you the schedule here real quick. Keep in mind, project duration, 900 days. These are calendar days. We're looking at completion of the connection project about 2 years from now. The project had gotten a little bit of a delay, what we call NTP, or notice to proceed, in that schedule. The NTP2 was the construction schedule. That was intended to happen around June or July, and it was delayed for contractual reasons until about August. So we've gotten a little late start. And then you can kind of see the Lawrence cost curve. The blue is the anticipated spend on us spending dollars at this point, and the orange is actual. So, you know, we're just a little behind, but we're starting to make up the schedule. And you can see the schedule performance index, or SPI, in orange here, of 0.66. If we were dead on track, we would be at a 1.0. So we're about 66% of where we wanted to be, but they're making really good progress right now. With that being said, I'm going to try to move to another slide here quickly and show you our connection video. We couldn't do a groundbreaking this year like we would typically do, and we'd have dignitaries out, we'd have the news media out. So instead, we did this video, and I'm going to quit talking here in a moment and share this video of our kind of how the project is kicked off and how it's progressed. I got to give Lisa Schwantes, our public information officer, a tremendous amount of thanks for developing this. She did a lot of work to make this happen. And hopefully, if I click to this, I don't know if everybody can see the beginning of this, please let me know. Or if I need to switch share again.
No, we can see it, Mike. Thank you.
Okay. And hopefully you can hear it. Are you hearing it?
No.
Okay. You know how it goes, Emily. We tried yesterday and everything was perfect. Give me 1 second.
And Mike and Emily, we may be able to just get this link added or emailed out to the membership if there's issues with playing it.
Okay. Let me check one more thing. My apologies. Yesterday there was one setting that is not showing up today, which is the sound. Yeah, I apologize. For some reason, it doesn't want to let me share the sound right now.
That's okay, Mike. We'll help get the link emailed out to the membership and the attendees on the call. Anything else from CDOT?
I think the other thing, you know, COVID's such a big thing for everybody right now. We've been doing a lot of strategic planning behind the scenes, just so people are aware. What do you do if, and we have what we call maintenance patrols across the state. And we'll have a maintenance patrol that takes care of the east side of Lizard Head and the west side of Lizard Head, or Mollison Coalbank, and then, you know, Red Mountain Pass, Wolf Creek Pass, et cetera, and all these different patrols everywhere. What do you do if all of a sudden you have a patrol that has an outbreak? And so we've been strategically planning, how are we going to shift teams around? How are we going to maintain our roads? How are we going to keep roads functioning through the winter if we have an outbreak? One of the things that we did initially last year, and depending on what level we go to, and I think San Juan Basin Health did a wonderful job describing, you know, we're in the yellow zone, we might go into the orange zone or even to the red zone. One of the things that we did is we said, we're going to isolate our patrols and break them apart and not allow them to cohabitate together, for fear that that prevents that potential for transmission if they're not working together. And they stay to their own isolated areas, they do their own work. So that was one of the things that we've got these plans in place. We know what we can do if we have a breakdown and we do have an exposure with a team and we have to have them quarantined for 14 days, how we can backfill, how we can take care of things. And so please, you know, everybody's trying to be as safe as they can, and we're trying to do the same ourselves just to make sure that we can keep serving the public through the winter. With the storm that we just had, you know, the last couple of days, Wolf Creek Pass had 38 inches of snow when it was all said and done. If we lose a patrol on that pass, that cuts off all of our, we have to shut the pass down. That cuts off all of the services that can come into the Western Slope. So we're very cognizant of that, and we're going to make sure that we maintain those avenues to keep that commerce coming in that supports everybody's lives that are over here on the other side of the hill. So very quick presentation. Sorry about the US 550 connection breakdown here. If you go to YouTube and you search for CDOT connection, you should be able to get to this and be able to play that very easily from that location. If you just type in CDOT, you'll probably get the name of a wrapper that is not CDOT, and it's a little different world there.
Super, thanks, Mike. Maybe we can get the wrapper to do the presentation.
Sounds good.
All right, we'll move to Nan from Southwest Health Alliance. Morning, Nan.
Hi, everyone. I'm actually having a choppy internet today, so I'm going to go back on no video here, but I won't mute myself, hopefully. Okay, so we have an update here on the Southwest Health Alliance. So I'm sure many of you have seen information about this and maybe even attended some of our presentations. So I'm Nan Penzruder, and I've been on the Southwest Advisory Committee for about 18 months. And we've done a lot of good things here. So we're happy here to just share the next 5 or 6 slides to give you an update. And also we're in open enrollment now officially, so we'll update on that. Could do the next slide. So Southwest Health Alliance, we actually worked with Peak Health Alliance up in Summit County, and we've been working the last couple of years to actually reduce the cost of health insurance costs in our community. And we are very proud to actually share with you that we've been able to reduce insurance premiums. This is in the individual market for the ACA, Affordable Care Act plans. We've been able to reduce insurance premiums by an average of more than 30%, which is astounding. And from the work we've been doing with our local providers of care, our hospitals and our doctors who actually accepted lower reimbursements many times to actually keep as much care as possible within our own communities, that type of conversation actually helped reduce premiums with other carriers throughout the state of Colorado as well. So a wonderful thing here, we are happy to announce that the insurance carrier that we are working with is named Bright Health. That is a company that has been around for at least 4 years, I think 5. They are A+ rated, which means they have excellent financial standing, and they are national, expanding nationally in areas of the country. And Peak and Southwest Health Alliance actually worked very closely with Bright Health, and Bright Health actually is the logo, you'll see it there, of all the coverages that we'll be offering. These are for effective dates starting January 1 of 21. And we're very happy to say that through all this work together that we actually have a local type of a comprehensive benefit plan designs, and you'll see that throughout. You know, we actually spun off, if you will, from Local First, or part of Local First. So those of you that know Monique DeGiorgio and all the great work that she does, we have an advisory committee with 10 or 12 people on it. Just one to mention Jack Llewellyn, you know, he's been very key with all of this with our whole community, and also what we'll do for businesses here as well. So you're going to see the Southwest Health Alliance branded plans. Those are in actually several counties around La Plata County here. I'll share those with you. And there's our logo, Bright Health and Peak. So if you're familiar with all of those, and I'm going to show you where you go to actually get information on these products. Next slide, please. Another success here is that we wanted the network to be as inclusive as possible. You know, there's some carriers, insurance carriers, that will say, hey, hospital A, if we let you in our network, let's keep out the other hospital. That is common in a lot of areas in our country, actually most of the areas. And our whole take on this is that we wanted this to be as inclusive as possible. So once we actually negotiated these costs of care, if you will, for services, we actually presented those both to Mercy and to Animas Surgical Hospital and our local provider network, the Durango Network of Physicians, independent physicians, and also mental health providers. And so we threw it out there and said, here's what is a fair reimbursement, and can we work together so that we have all of you in a network? So we're very happy to say that we do have both ASH and Mercy and lots of providers. And this all goes back to our values of transparency, and right at the grassroots level, we use data, and we actually analyze the data. This would be claims data, and actually came up with what we saw as a fair reimbursement for different services. And it's also, hits the values of, self-reliance and accountability, which those have been our prime values in all of this work that we've been doing the last couple of years. And so the Shop Local, we have this health coverage is actually offered in 4 counties. So we have La Plata, San Juan, Dolores, and Montezuma for residents of all of those areas. Next, please. Okay, just a snippet of some of the plan designs. For those of you that know about the individual coverages that are on the Affordable Care Act or part of the ACA, you'll hear bronze, gold, silver plans, even platinum plans. So they're set up by different metal levels. And we're happy to say that we actually have plans spanning the catastrophic bronze, silver, and gold. And what that means is that we have a lot of plan options. And one key, goal that we had for the plan designs is that we wanted to reduce as many barriers to care as possible. So a barrier to care could be a very high deductible. So that first dollar amount that folks need to pay before they can seek services. And also, co-pays that sometimes are very high. So here's some of the features that we actually built into those various plan designs. And we have many options. I think there's more than a dozen actually, different options that will be a combination of these type of attributes in a healthcare plan. So we even have, some with $0 deductibles. We actually wanted to make sure we had no limitations for primary care and specialty care visits. And we're happy to say we have flat dollar copays for those, not subject to a deductible. And we also can provide access to specialty care visits without first going through a primary care. So that's called a gatekeeper. So we don't have any gatekeepers. If someone needs a service with a specialist, they can go to one. And this next one, MRIs, lab, x-rays, a lot of times people won't know how much they actually have to pay as far as a co-insurance percentage on any of those. So we set up flat dollar transparent amounts for those services. So for example, if someone needs an MRI, there's a flat dollar amount that that you will be responsible for upfront. You don't have to wait for a surprise, a few weeks or a month later. And then this last one is very important, certainly with pandemic and, we see increased levels of depression, anxiety, a lot of need for these services right now, especially. So we actually enhanced and expanded our mental health benefits and the network. And one thing that we found through our analysis is that the mental health providers weren't being paid even an average kind of fee, if you will, from insurance companies. So we actually were able to increase the amount that the mental health providers receive. That's actually closer to the amount that they would charge for if you were a cash paying customer. What that means is that's certainly an incentive, for more mental health providers to join the network. And I will say that we're every day building out more and more folks into the network. So if you run into your physician or your mental health provider and you ask them about Bright Health and they're not yet in the Bright Health network, please ask them to contact Bright. Bright has contacted them, I will tell you, multiple times, but we are still, working to get the message out. And this is an ever-changing, expansion of the network as more and more actually come into the network. And the next,
we've got a question.
Sure, go ahead.
We have a question that ties into that a little bit. If you have college students under health insurance policies out of the region, would this program work for them?
Yeah, that's a great question. So the program is, with the primary network, is local based. However, there is coverage for any type of emergency, anywhere in the country, right? So hopefully the student wouldn't be having an emergency situation, but there would be coverage for that. And there is another way to actually get coverage, that Bright Health does have networks in other areas of the country. So it could be as easy as a phone call to Bright and asking, I'll just use this for example, do you have any, do you have a network in Texas, for example? My kids at Austin, do you have, any, physicians in your network there? Bright is expanding throughout the country. So what their plan for sure is that anyone could actually access that Bright network in areas. So it would be we'd certainly need to ask a question on that, but it's possible.
Super, thank you.
Should we go to the next slide? Okay, here, this is a snippet of SHA, Southwest Health Alliance rates, and they actually are the lowest. We filed the rates with the state of Colorado the Division of Insurance. We filed those rates back in May. So did every carrier who actually wants to have products available for 1/1/21. So there's a lot of lead time where we file these rates. We did that back in May, and the rates were all just approved, if you will, actually just I think it was the first week in October. So the Division of Insurance actually does a lot of calculations and actuarial evaluation, and they approve the rates. The rates are now online, and I will show you where those are here in the next slide. What I want to or could you go back a second? Just draw your attention here. So the rates at the top, so there's a catastrophic plan. That's a special plan only up to age 30. But then you see these select bronze, silver, silver, gold. So we actually picked rates for an age 40-year-old. All of the products actually, they're regulated by federal and state law, but all of the products actually are age rated, which means there can be a different premium, and there is a different premium for every single age. There's no gender rating, so male, female doesn't matter. It's the same rate. But we did just pick one rate, and these are for 40-year-olds. So you can see the Bright Health peak up in Summit County and other counties, and then our 4 counties down in our area. We all actually have the same rate for those mountain communities. And just as a comparison, right now, Friday Health Plan, that's their name, Friday, Anthem and Rocky Mountain, they actually have coverage in our area this year and for years, but these are their rates for 2021. So we wanted to show an example of, the significant reduction as a comparison that we, with the other carriers. And as I mentioned, these other carriers actually were influenced to actually reduce their rates as well. So you can still see the astounding, decrease that we have, which is wonderful for our community and our families and individuals, certainly that buy coverage. And then the next slide actually is just one little piece, like one line that's on Connect for Health Colorado. So that is the online marketplace or exchange. If you ever hear those words, it means the same thing. Connect for Health Colorado is where you go to find these products. So you put in a few pieces of information, your zip code, your age, and then you're able to actually pull up all of the products that are offered. And a really cool thing is that we have our logo next to Bright, which is wonderful. So you can see Southwest Health Alliance right there, that, you know, connected partnered product. And then also the rates pull up by the lowest premium to the highest. So it's like when you scroll and you do a Google search and you see what comes up on the first or second page, you're going to see a whole bunch of Bright and Southwest Health Alliance plans on those first and second pages because they are the lowest premiums. And there's different ways to sort. But we also, of course, endorse and recommend, we go to the next slide here, recommend that you use your broker for more information. And I skipped a little bit ahead here. I do want to mention this. These plans can be used for businesses. So when you think of an employer group that actually, or a small business that offers group health coverage, there's a special mechanism called ICHRA, which is a horrible acronym, but it stands for an individual coverage health reimbursement arrangement. And that is actually a guideline and regulation that was set up about a year ago at our federal level, Health and Human Services, that actually said, hey, businesses, if you want to offer individual coverage into your group setting, that's allowed. And what's going to be allowed is that you can have your employees set up an individual health reimbursement account, and then the employer actually makes a monthly contribution to that account, and then the employee can use those funds to actually go and purchase whatever individual coverage they want. So it's not completely disconnecting, if you will, an employer from offering coverage, but it is another way to access these really low rates that we actually will experience here in our Colorado market. So this is a very important concept and topic. And I've had a few of our accounting firms in town actually reach out to us. We've talked with them. Our local brokers have been educated on this. And it's certainly a very important feature to look at if you're a small business, even if you're a large business, because we have this phenomenon now with these low rates and our state reinsurance pool that actually makes our individual rates lower than group rates. So we have scenarios where, I'll give you an example. We had a small employer group of 11 employees. Their current small group premium is about $10,000 a month to cover those 11. They could move to a richer plan design, right? Like they're on a silver plan. They move to a gold plan under a Southwest Health Alliance individual coverage plan, set up an ICHRA, and actually have their monthly premiums go to $6,000. So that's a 41% savings. Everyone gets more robust coverage as far as a richer benefit, and annualized, that's over a $50,000 savings for that small business, which is amazing. So we are absolutely recommending to contact your broker, your local broker for more information. You can contact me or Monique. We'll get you hooked up if you want more information on this. We're answering lots of questions, and there's a lot of interest in looking at this. And you can do it throughout the year. You're not limited by the open enrollment period if you're a business that might want to move to this.
Super. Thank you, Nan.
Yep. Okay. So last one is our Shop Local. The enrollment opened November 1st. It goes to January 15th. That's for individuals. And Connect for Colorado Health, that's where you go, get with your brokers. And on the Peak Health website, there's actually a list of preferred brokers, which just means that they've undergone additional training in all this, and they should be even to help you even more so than just the average. But any broker you can go to, any broker that has health insurance. So thank you so much for your time.
Thank you, Nan. We'll move on to Matt Salka, the newly elected La Plata County Commissioner. Welcome. Good morning, Matt.
Thank you and good morning. And first and foremost, I want to thank all of my supporters and especially the voters that came out in La Plata County. Great numbers, and I'm excited to work for everyone in La Plata County. I'll keep this very brief because I know we're over time, but the three key issues, I've done this in my stump speech quite a bit during my campaign time, but the three things that I'm really going to be looking at is quality jobs, working with the Alliance, Region 9, the many chambers in La Plata County, attainable and affordable housing, working closely with Homes Fund. But also the other third item is infrastructure improvements, which is our roads, our bridges. We need to work on our budget for that section. But most importantly too as well, we've noticed today was broadband. I'm excited to work closely with the organizations in La Plata County to get better access to broadband in La Plata County. The third one, the next item is meetings. I'd really enjoy the current county commissioners, how they have open public meetings to be able to meet with La Plata County residents. I will be doing the same thing, but I will also try to bump that up and do night meetings as well. So the working citizens out there to be able to talk to a La Plata County commissioner will be accessible. The other option too as well is I want to work closely with the county commissioners in January to be able to do on the road tours, to be able to not only for me just to do open meetings in my district, but also work closely in District 1 and 2. And and most importantly for me is in January, I'm excited to get back to work with all of you organizations and businesses closely and help continue the relationships I've built as the past mayor and ready to keep moving forward as county commissioner. As you see, you can email me anytime, matt@mattsalka.com. As well, I will be soon having a county email address. So then I will start forwarding you to that area so we can talk more about business. But again, thank you all for all your support and thank you for your vote. Thank you.
Awesome. Congratulations, Matt. It's good to have you back.
Thank you. Feels good.
We'll move to Commissioner Clyde Church for a La Plata County update.
Matt, thank you. What a lead in there. Welcome to the board. Can you hear me all right? Is my audio set?
We can. You're good.
Thank you very much. Matt was talking about meetings, and I have office hours this Thursday, November 12th, 3 to 5 p.m. And that'll be a call-in, and it's 382-6212, and you can reach me. I'd also like to say a great, huge thanks to Tiffany Parker, clerk and recorder staff, as well as the dozens and dozens of volunteers we had spread out all over the county, picking up ballot drop boxes, poll watchers. It can be entertaining sometimes, but usually it's a very serious job, and it's a great service to the community. I'd like to say that I wanted to mention sales tax too. Sales tax for August, the reports lag because of collection time and reporting. Sales tax revenues in August was up 16.8%. Revenues reporting year over year, 14.5%, or 2.2 million and change over the same period in 2019. There was a one-time collection in there that bumped it up a little higher, but it's still up. Retail trade was up 44%. Food and beverage was up 25%. Now this is over a year ago, comparing August to August of 19 to 20. Marijuana was up 62%, retail sales. Building material supplies was up 20%. If you've been out to some of our suppliers, it's busy out there. Accommodation was also up 9.7%, but we'll probably take food and beverage, probably take a hit coming up with potential closures here and reductions in seating. Let's see. Yes. The largest decrease is seen this year, March and April, where collections were down 53%. Remember, during the first stay-at-home orders when the food and beverage was closed. So with that, I'd want to say one last thing. I want to say at the request of San Juan Basin Public Health, La Plata County stood up the Emergency Operations Center, and that is to provide coordination on all dimensions of the emergency response, from PPE to legal to resources to recovery. I'd like to say that we'll have a report in the January, February timeframe, a snapshot looking backwards countywide at the contributions, organizations, Region 9, and the banks, Economic Development Alliance have made to the county. So look forward to that. So with that, that's all I have. Thank you so much.
Thank you, Commissioner Church. We'll move to Councilor Barbara Noseworthy. Barbara, are you there?
I am, sorry. I will stay dark because of computer issues. I have 3 points that I'd like to cover: COVID, budget, and our Urban Renewal Authority. On COVID, I think, first of all, a huge thanks to Leanne Jolan and Brian Devine and all of the staff at San Juan Basin Public Health for the work you continue to do every day to keep our community safe. I know you've been working since January, long before we were starting to think about COVID. Thank you. I think it's important to emphasize some of Brian's points. On November 1, La Plata County alone, just among its residents, had 433 confirmed cases. As of November 8th, that was 607 confirmed cases. And Brian's comments, we are alarmingly close to a stay-at-home order for La Plata County, should really be noted. But the good news is that what we do in the next 2 weeks can determine and have a positive impact on really helping us control the spread of this virus. So I want to emphasize that very much. The city will be looking at ordinances with more enforcement potential, and we'll be looking at that at our city council meeting next week. Also, there will be a news release coming out that the city has had a few employees who have tested positive for COVID, and we have an outbreak is identified as 2 or more cases at one business location within a 14-day period. And we have had 3 of our employees at the 911 Communications Center have tested positive. They are in isolation. They have only had close contact with one other person who is quarantined. Because of the remote location, we do not feel that this presents a risk to the public, and our operations are continuing as normal. So please, if you feel that you need to call 911, please do so. But I did want that we will be making a public release about that to inform the public, and I wanted you to have that news up front. So again, we are really encouraging people to follow the public health measures, wear a mask, so when in public, that means over your nose and mouth, maintain a 6 feet minimum, stay at home as much as possible, get tested if you have any symptoms. On the budget, we presented our budget, the city manager, Jose Madrigal, presented our budget last week at a retreat. It was, I've heard from many people in the community, it was probably one of the best budgets they've seen, much easier to read. We will be reviewing it again on November 17th, and then again in early December. So I'm very positive on that front. And finally, our Urban Renewal Authority will be having a meeting on November 12th at 5 p.m. That's for the Midtown redevelopment area. So property owners have been informed of this, and the public can also participate. That's all I have right now.
Super. Thank you, Councilor Noseworthy. We'll move to Mayor Ashley Tarkington in Bayfield. Morning, Ashley.
Actually, instead of Ashley, it is Beth Lamberson today. Can you all hear me?
We can. Morning, Beth.
Good morning. To Matt's point about broadband, our mayor had some difficulty with broadband or internet at her house. Hi, I'm Beth Lamberson. Many of you know me as Beth Warren. I am now in my 8th week as the Economic Recovery Coordinator for the town of Bayfield. The biggest thing that jumps out to me this morning as we look at all this information is we're not talking about the fact of the employee's paycheck. So last Thursday, under the direction of our town manager, Katie Sickles, and Ashley, our mayor, I sent an email, an infographic to 175 Bayfield businesses that said, first of all, the situation exists because of people coming to work sick, but what we can do as the town for those individuals. So I can personally direct them to the Community Emergency Assistance Coalition, Aid to All, the La Plata Electric, up to $100 in relief for your utility bill. So when we're talking about how we really want to make an impact when we're on this cusp, we really have to look at that person that's not only living paycheck to paycheck, but living shift to shift. So that's been a huge focus of mine. Additionally, yesterday I was given the task of assisting all residences in Bayfield with applying for LEAP, Low Energy Assistance Program. First of all, for their heating bills, and then secondly, the town of Bayfield is implementing that for their utility bills. So the biggest thing I feel that we can do right now with masks and social distancing and everything else is keeping people safe, warm, and housed at a time when even missing one shift at work can have a huge impact. Additionally, my job has been to distribute $60,000 in Bayfield Cares grants. Right now we're at $58,500. The checks have been given to the businesses in advance of their expenses, though with some it's been a reimbursement, but we felt very strongly again that cash is king. We had a very simple promissory agreement signed that would hold up in small claims court if that were the case. So things are rocking in Bayfield. Sales tax is up. I feel like I am 1/3 social worker, public health, and economic development. And the Bayfield community felt really isolated during the shutdown, simply because very few of those folks have are members in the Alliance. So they weren't seeing the incredible playbook that was put together by Mike and Emily, that kind of thing. And now we're in a position where people have left my office in tears saying that they think now they're going to make it. Our biggest 2 sectors served in Bayfield with those grants, which the max was $3 grand. We did 7 restaurants and 7 salons. We also, we have manufacturing, we have a gunsmith. I mean, it ran the gamut. And we bought technology. We're helping to pay for outdoor tents and fire pits, but requiring that they buy those at Lewis Mercantile, keep that money local wherever possible. And we're really rocking it in Bayfield. But I would really encourage everybody to go back to that idea of somebody staying home from work, what it means to them economically, and how you as an employer, or in our case, as a municipality, can help out. So thank you all.
Super. Thank you for the update from Bayfield, Beth. Really appreciate it. Just to close out the meeting, it is 9:15. We've got no questions that have gone unanswered at this point. We really appreciate everybody kind of staying on a little bit longer today. In summary, obviously, the COVID positive cases are kind of surging. I think the update from San Juan Basin Health, especially going back to our business community, our municipalities, we all need to do our part. We need to wear masks. We need to socially distance. We need to do everything we can to try and control kind of a fall surge and keep kids in school. So we appreciate everybody coming in this morning. Mike or Emily, anything in closing?
Don't have anything, Jameson. Thank you so much.
Neither do I. And I hope you all have a good week, and we'll see you next month.